This is Dr. Cruz from Kentuckiana Integrative Medicine. Can you tell us your name, please?
Mary Mendel.
And Mary, what brought you to our office?
I have had 80 and 85% blockage in 2 of my heart vessels, severe shortness of breath, swelling in my legs, ankles, and feet, and just generally not feeling very well.
And that was going on for how long before you came to see us? Roughly. 3
The
months?
last, especially the last year.
Okay. So with 80% blockage in 2 arteries, or 185, and I think you also told me you have blockage in a carotid with a stent, and you have atrial fibrillation. I'm sure that your heart doctor sent you to a surgeon or another heart doctor that does stents, right?
Yes.
And how did that conversation go?
My heart physician sent me to a cardiac surgeon who wanted to do bypass surgery, and I was like, no thank you. I knew about chelation and felt like that would be a better choice for me. And then I was also sent to another cardiac surgeon who wanted to put stents in, and he was not open at all to the fact that chelation and plaquex could dissolve some of the plaque and help my living, So, but by that time I had undergone quite a few IV chelation and plaquex, and I had no more swelling in my legs, ankles, or feet. The shortness of breath was greatly improved. The only time I'm really short of breath is if I go up a flight of stairs like 13 or 14 steps, and then it's less recovery time than what it had been. And he was still not open to that, but I told him I was not planning on having stents placed.
Great. So Mary's done roughly 20 IV chelations and 20 IV plaquexes, and she's, would you say 50% better, 70% better?
50 to 60% for sure.
Okay. The normal course of IV therapy is, at least when your heart disease is as advanced as Mary's and they're wanting to do open heart surgery or stents, is at least 40 to 60. So Mary's only done 20, she's got another 40 to go, but pretty impressive results that with 20, she's already 50 or 60% better. And what folks don't realize is that, if you do a round, according to Dr. Gervasio Lamas, who's a Harvard-trained cardiologist, if you do a round of chelation, which is roughly 40 to 60, you reduce your chances of death if you are not a diabetic by 20% for the next 5 years, and you literally reverse heart disease. If you're a diabetic, you reduce your chances of death by 40%. So the benefits for a diabetic are dramatically better. Again, all causes of death are reduced by 5 years. So you're dramatically enhancing your longevity. And what most folks do is get through their chelation battery of 40 to 60, and then they do maintenance. But you can wait. The only problem is that most of us do not have the discipline to do lifestyle changes. So heart disease will progress, and this is the fastest, most effective way that I know of to reverse it. Not necessarily permanently. And yes, heart disease can be reversed with certain diets, but most of us don't have the bandwidth to, eat like the Cleveland Clinic and the China study, which is strictly vegetarian. So you're about 50, 60% better, and we're thrilled. And what happened when you told your cardiologist that you were better, or how did that part go?
Well, he basically just said, well, it's never going to work. And I was like, well, you need to listen to your patient's symptoms maybe, because I feel like I'm greatly improved from what I was previously.
Right.
And so he agreed, maybe I do need to listen.
You know, we had, this is how funny our brains are. I had one patient rather, who the heart doctor said, you have a new artery in your heart. Okay, and he was, dramatically better. And of course, the patient said, well, this happened because of IV chelation. And the cardiologist said, I still don't believe in it.
Uh-huh.
So there's a new blood vessel, and he still wouldn't believe in it. It's hard to convince folks that are that stubborn.
That's right. He was looking for a new car.
Right. All right. So, what do you think? Your name?
My name is Don Mendel, and yes, I think Mary has greatly improved by leaps and bounds towards what she was, say, 3, 4, 5 years ago. I mean, she couldn't even walk around the house without sitting down and saying, hey, I'm really tired, and maybe even take a nap. And she can go up and down steps to our basement and to our outside entrance much easier and less effort and less fatigue, and definitely not as greatly out of breath had she been previously. And this is probably in the last 4 or 5 months since she's been taking these chelation treatments.
Wonderful to hear. Thank you both for sharing your testimony. We really appreciate it. And that is the end of the interview.